Hello, my name is James Tyler Farrell. I'm the Vice President of Beautiful Kids. We're here at the office of Dr. Kimberly, s.salkey, local area dermatologist, and we're here to do an interview, first of all in honor of alopecia awareness, and second of all in honor of Black History Month. And our interviewee is Dr. s.salkey, professor and clinician at EVMS dermatology. Dr. s.salkey, why did you choose to study to become a dermatologist?
Just by way of introduction, I'm Dr. Kimberly s.salkey, and I'm an assistant professor of dermatology here at Eastern Virginia Medical School. My job includes seeing patients as well as teaching students who are in medical school and students who are studying to become physician assistants as well, and also dermatology residents. There are a lot of things that I love about dermatology. I have to say my interest started very early in that my mother is a retired dermatologist, and so I got some exposure even from the very beginning. I definitely wanted to be just like her when I grew up. Aside from that, though, there are a lot of things I like about the skin. It's something that's easy to see, and so when you're forming that partnership with patients, you can see what the problem is, they can see what the problem is, and you can work on it together. My interest in hair came about a little bit after my interest in skin. I could see that there was a real need in the area, and unfortunately there are a lot of questions we still don't have answers to regarding skin disease, which is why it's so fantastic that there are organizations like Beautiful Kids who are striving for more information. But because we don't have a lot of answers, it's an area where a lot of people don't necessarily want to focus. You know, in medicine we like to have a diagnosis, and then we like to have a cure. And hair loss is something where we just don't have that information just yet. So a lot of providers tend to shy away from it, but I could see that there was a need, particularly in this area, and decided to take up that need and see as many hair loss patients as I can and provide the best care that I can.
What makes you continue to support Beautiful Kids?
Supporting a group like Beautiful Kids is important to me because, again, there's just such a big need in this community. Unfortunately, problems like hair loss are often considered cosmetic by insurance companies and sort of powers that be, and so patients don't get the care or attention or assistance that they need. Sometimes even having their medical bills declined because hair loss is considered cosmetic. So any group that helps to address the needs of patients in that way is definitely worth supporting as far as I'm concerned.
Why are alopecia studies important to you?
I think the answer there is the same. Alopecia studies are important because there's a lot of information we just don't know yet. And so the more research we do, the more information we can get, and the better we can treat patients.
Okay. Now, you said earlier that your mother was a retired dermatologist. Have you ever experienced anyone in your family or in your immediate circle that has experienced skin disorders or hair loss?
Not that I can think of offhand, to be honest with you. Not really, but not having a direct, family connection certainly doesn't keep me from having a personal connection to my patients. So I definitely feel connected to them.
Okay. And where do you see the care of patients as well as research and education of students now at 2015 in the future with regard to hair loss research and skin disorders? Where do you see that going in the next 5, 10, 20 years?
You know, there's a lot of exciting research that's happening right now, and there are a lot of different types of hair loss, and so some forms definitely get more of a focus than other forms. Alopecia areata is a condition that a lot of the folks who are supported by Beautiful Kids suffer from. Unfortunately, that is a big area of research, and so in the future, I think more effective treatments are going to become available, safer treatments are going to become available. But right now, having the financial support as well as the interest there are the kinds of things to really keep that research moving forward.
Okay. And kind of building on that, what are your how do you feel, or are you very, what are your feelings with regard to progress that is made in skin disorder and hair loss research, such as light therapy and also holistic medicine? With regard to those two things, do you see those issues or disciplines as helping the field of dermatology now and in the future with regard to finding cures for skin disorders and hair loss?
That's a complex question, but in terms of light treatment, that's absolutely something that's an old treatment for alopecia areata in particular. Been around a long time. It's not perfect. If it was, then every patient would be treated with that, and that would be the end of the story. I have to give a disclaimer with regard to holistic treatments because my training is in traditional medicine, and so I don't have a lot of experience with that. I do have patients who come in and tell me they've used all sorts of remedies and some things that I'm less familiar with, but I don't argue with anything that brings improvement and doesn't cause any harm. So I certainly am open to those things, but I can't exactly speak to their utility or effectiveness.
Okay, and in closing out, we do want to stress that, again, this is Black History Month, and we see you as a successful black woman in the field of dermatology, physician, and we, support you very much in all you do for the community and for BKO. And BKO would like to take this moment to salute you and all the help that you've given us in volunteering your time over the last several years at each of our fundraisers, as far as being an expert consultant with regard to alopecia and dermatologic issues.
Well, thank you. It's my honor to give back year after year, and it's been such a joy to watch the show grow larger and larger and more successful each year. So I thank you for giving me the opportunity to contribute.